many of the side effects that we experience are actually not because of the cancer. It's because of the treatment or because of the menopause we're placed into to address what feeds our cancer. About 60% of cancer patients are actually estrogen receptor fed cancers. And many of us are put into either a temporary or a permanent menopause to address the free flow of estrogen to keep that cancer from growing any further. So women in their 20s and 30s are not meant to be in menopause. They're meant to have a free flow of estrogen that allows them to think clearly and process things in a cognitive fashion, that allows them to have a libido, that allows them to have energy, even things as like resilience of skin and suppleness in that respect are driven by estrogen. So when estrogen is the enemy, it can actually create a lot of quality of life issues in all stages of cancer patients. So it's a difficult thing to manage because you can't take an estrogen supplement to address that, because you'll be feeding your cancer by doing so. So we try to incorporate a lot of things like yoga, for example, for additional concentration benefit and also flexibility. Drink a lot of water. That's going to help you with some of the dry side effects. There's a whole conversation I could get into from a libido perspective, and just having the ability to be intimate with somebody. It's very difficult because we have the vagina of a 70-year-old, and we have to laugh about it because we'll just go crazy otherwise. Um, but definitely work with your oncologist. And it's hard to be honest about these kind of things, especially as a young woman. There's an embarrassment factor, obviously, but there are additional social workers and nurses who would be happy to have those conversations with you, um, to find out what exactly can be done to manage it. So, for example, I was having tremendous hot flashes with having my ovaries removed at the age of 31, to the point where I couldn't sleep. It was miserable. And we found the right combination of, believe it or not, antidepressants to help manage that. So it helped with some of the psychosomatic and some of the physical symptoms of the disease. There's nothing that you can tell your oncologist that they haven't heard before. There's nothing you can tell your oncologist that is going to shock them. So try to find somebody that you feel comfortable with and asking how to manage some of these side effects, because I promise you there's something out there that will help, and there's people out there that really understand.